Uganda says it has quarantined over 100 people. 43 of these are Chinese nationals. Most of these are travelers coming from China. This comes as the World Health Organization is asking African countries with significant numbers of people traveling from China to heighten intervention efforts to stop the spread of the coronavirus. CGTN's Isabel Nakirya reports.
Uganda's Ministry of Health says it's well prepared to manage the coronavirus in the event of a possible outbreak. It stepped up screening at all entry points, including the main international airport. Travelers coming from China and other countries affected by the epidemic will be isolated in their homes for close monitoring.
They will be followed up for a total of 14 days by our surveillance officers, who will monitor them for signs and symptoms of the 2019 novel coronavirus on a daily basis. After 14 days, quarantined persons will only be released by the surveillance officers upon certification that they are okay.
Health workers have been trained to identify and care for suspected cases, but the Health Ministry says the 2 isolation wards available for suspected cases do not have the capacity to handle large numbers of travelers from China. Uganda has learned lessons from the multiple outbreaks of Ebola in the recent years.
With recent outbreaks such as Ebola, also have strengthened our systems in infection prevention and control, as well as in laboratory. I will say, though, that this is a new virus, so we're still learning. We've moved very quickly to identify the virus, to develop a diagnostic test, to learn about how it's transmitted and how we can respond.
The government has now set aside $7 million to manage any possible outbreak. Uganda has not banned travel to China or any affected countries, but has warned its citizens to delay their flights until the situation normalizes. For now, Ugandans have been asked to wash their hands with soap and avoid shaking hands to control infections. Isabel, Nakirya, CGTN, Kampala, Uganda.